Folks, it's my pleasure to introduce my good friend, Dr. Lisa Liao.
Hey Mike, how are you doing today?
I am living the dream, darling. I tell you what, it's been great. Let's tell you what, we got some questions here, but well, first I'm going to ask you, first of all, I want to mention they've been helping my family and I for years. How I really wondered, but you're still a businesswoman. How has this COVID crisis affected your business? And also, can you give us updates a little bit on this video and telehealth appointments?
So, video and telehealth medicine, we've actually been doing those for over 20 years. And one of the interesting things is that prior to COVID, insurance actually didn't cover it, and now insurance is covering it for physicians. So it gives physicians an ability to decrease the amount of traffic basically in their office,
Mm-hmm.
which is great. It's safe. Not every person needs to go directly into being seen, but sometimes as a physician, we need to take a look at that earache. Sometimes we need to take a look at those tonsils, or we need to listen to that heart. A lot of things still need procedures and hands-on medicine. So it really takes a physician to listen, take their time, get a great history. And back in the day, we were always taught that if you listen long enough, the patient knew exactly what was going on. So it's a time to listen, and for more than anything is have a great relationship with your patients. I think we're very blessed here is that it's about truly knowing our patients, listening to their needs, and providing them the best care that we can.
Well, I know for you, you can go, well, I know that your brother has this problem and your sister has this problem, your mom and dad had this problem, and that kind of all that it all wraps around it, doesn't it?
It does. It all wraps around it, and it's all about when you know the family, and that's the way. One of the reasons why I chose family medicine is because behind every door is a whole different problem, and so you get to put your detective hat on and listen to the person and get to know them. Now, I truly miss hugging and loving on my patients because I'm old-fashioned. It's just as a Southern girl, we would hug on our patients, and in today's society, now we'll do. The elbow bump, we might do a little bit of a dance, and you'll probably see those on Instagram as well because we do post those. It's just about being silly and having fun, and if there's not laughter in the office, we've left the building.
Yeah, I know. It's real funny is when you do a video like FaceTime or something. I'm not talking Zoom, but a FaceTime type thing.
Mm-hmm.
You can actually tell a lot looking at somebody. But honest to gosh, you're gonna have to feel a lump on your your thyroid. You're gonna have to feel this or that, and just it's like I can't imagine seeing my urologist without having him in person.
So for maintenance, it's really easy to be able to do
Sure.
telemedicine or video medicine. But for new patients, it's very hard, and really very recently we were not allowed to see new pain patients, somebody who may have had a major back injury or had surgery. If you were seeing them for the very first time, you could not write them pain medication by a telephone or video conference.
Mm-hmm.
And they just changed those rules just recently as of last month. So it's just trying to keep everybody safe. I think in this nation we have enough ways for physicians to cross-check, double-check what the patients are taking with our basically, most states have the ability that we can look and see every medication that they've taken in the last 2 years.
Yeah.
So it helps to keep people safe, and we still, as providers for addiction medicine and pain management, as well as family medicine and integrated medicine, is that there are still some things that we have to have them come in and do, whether it's urine drug screens or saliva drug screens.
Mm-hmm.
We're keeping everybody safe and keeping the protocols going. So if you have a question or you have a family member in need, don't hesitate to reach out to us, even if it's just to answer a few questions, or send us a message on info@everydayhealthhacker. We're here to help.
Awesome. All right, we've got a couple questions here. Lily writes, she's 53, and as of 2 years ago, she suffers from migraine headaches. The problem is, I don't like the way prescription drugs make me feel, is what she says. She goes, I feel like a zombie. And that's what some of them do. And her sister's a nurse practitioner in another state. She says that it could be if I change my diet or drink a lot of water or exercise regularly, that would all help. Of course, it's her sister. She doesn't always say anything, but how could that possibly make a difference?
Well, family dynamics are always interesting, aren't they?
Yes.
So, and her sister is actually, Lily, your sister has a lot of understanding of what this can do. And there's something that's called an anti-inflammatory nutritional plan. And we have that listed on everydayhealthhackers.com. And one of that is that I'm going to share with you, and yes, you have to drink a lot of water. But here are the top 5 when you're changing your nutritional plan, I don't like to say diet because nobody wants to be on a diet. A nutritional plan is something that you're going to have as a lifetime of what you're going to do to help yourself be better. And the first two are really, really simple. That's no smoking, no drinking, alcohol. So those are simple. You can drink water, but not on the alcohol. The third is no carbs, no sugar, and the fifth one is the hardest one, I think. It's no dairy. And so if you're going to choose something that is a dairy product, or you're going to have like cheese, try and choose a cheddar that is not orange, because you know what, Lily? There are no orange cows. So think of that when you're buying your foods and trying to stay away from processed foods. And yes, that can help. And then the other is exercise. And if you're still having migraine medication, migraine headaches, let's take a look with your physician as well as your dentist, because it can be as simple as your bite being off. And when I say your bite, is that your TMJ joint that works with your maxilla and your mandible, that's your top and your lower jaw, and those work together. And sometimes when they're misaligned, it can cause you to grind, and then you'll wake up with headaches, and that headache can turn into a migraine headache throughout the day. And that can be from cluster headaches, tension headaches, to migraine headaches. So seeing your dentist is also important as well with headaches.
Getting old is not for the faint of heart. I tell you what, it's not fun.
It's called getting wiser, increasing your ability to be a sage. It's not about being old, it's about being wiser.
There you go, smarter. All right, cunning. All right, Connie. She writes that she's 55 and starting to see some of those older lady wrinkles and changes in her face. They also seem a bit more loose skin wrinkles on her legs and things like that. I've got that. She wants really tips on delaying old man times effects just a little.
I so appreciate that, Connie, because actually there's a lot of very natural ways to do that. So yes, you want to use skin creams, you want to have a good nutritional plan. There's something that's called PRF. Now, back in the day, we always heard about some of the dermal fillers that we've heard from Restylane, Sculptra, just to name a few. And there's something that's very natural that's called PRF. You may have heard PRP, plasma-rich plasma, or plasma-rich fibrinogen is PRF. And there's different sources of that. And what we do is that we actually take your blood, we spin it down to the fibrinogen layer, and then we reinsert that into the person in the areas that they have the most aging, let's just say that the areas of aging. Okay. And what that does is helps to increase the collagen very quickly. It's an automatic effect. You can see it within the seconds after you've been injected. And it also helps your body to make the collagen, so it's called collagenesis. So PRF, and take a look at us at Meridian Health Institute. We talk about that a lot on our Facebook page as well as our Instagram, in addition to our @Everyday Health Hacker. So what we want to do is try and do very natural things that do not have side effects and be able to give you that result where you're looking 7 to 10 years younger and feeling good about it.
In other words, you're not going to have them be like some of those actors and actresses that have had all these injections and they look different. I'm trying to put it in a nice way. I don't know how to put it nice.
I want you to accentuate the beauty that you already have. I mean, we have every laser here known to man for, oil therapy and Fraxel and things like that. But for something that just want to kind of freshen up the look, PRF is a great answer and something that's very affordable.
Awesome. It's not injecting crazy stuff into your body, right?
That's right.
All right, folks, we're out of time. I want to thank Dr. Leal for taking the time to help us on the path to better health.
Thank you, everyone, for joining us today, and we look forward to talking to you all next week.